Let's go over the blood transfusion. So remember what I said on the slides. We only need 3 items to start a blood transfusion. So we need a unit of blood, correct? Unit of blood. We need the tubing for the transfusion with a filter, right? Because the filter is going to catch, the purpose of the filter is to catch any clumps or any clots that could develop, because we don't want to push any clots into the vein. You will cause a pulmonary embolism, correct? So we need a unit of blood, we need a tubing with a filter, and the third thing we need is a bag of normal saline, right? To 0.9% sodium chloride, right? So remember, normal saline is known as sodium chloride. Let me just write it down. Sodium chloride, okay? 0.9%. So remember that. If the NCLEX tries to throw you off, they might not write normal saline, they might write 0.9% sodium chloride, which is the same thing as normal saline, correct? So these are the 3 items that we need to start a blood transfusion. We need a unit of blood, and in this example, we're talking about blood transfusion, but you can need, if it's a platelet, let's say you're going to be transfusing platelets, it will be the same exact thing, okay? But for this example, we're talking about a blood transfusion, so we're talking about 1 unit of blood or multiple units depending on how many the doctor or the healthcare provider orders. We're going to need that tubing with the filter to catch any clumps or clots, and then we need that bag of normal saline. The only fluid allowed to be given via the same line as blood is normal saline and nothing else. The NCLEX is going to try to throw you off by asking you if it's okay to give lactated ringers, D5W, or any other type of fluids. So just remember, normal saline, 0.9% sodium chloride is the only fluid that can be administered with blood transfusions. So remember that. Prior to the transfusion, we're going to need a couple of things, right? First thing we're going to need is, we're going to need that type and screen. Type and screen. The purpose of the type and screen is we're going to get some blood from that patient and to find out their blood type, right? So the type and screen is for the blood type, so we get the right blood. So blood type, okay, we need a healthcare provider prescription, healthcare provider prescription, right, and order. Okay, we need a set of vitals, correct? For baseline purposes, baseline. Okay, so the set of vitals is for baseline purposes, okay? We need to find out what their blood pressure is, their heart rate, their respirations, their temperature prior to doing anything, just so we have a baseline to go by in case there's any reactions. Another important thing is we must ask about religious preferences, right? Okay, we want to find out there's certain religions that do not allow for blood transfusions, okay? Remember another thing, you want to monitor that blood, assess the blood bank once you get it. So remember, when you get the unit of blood from the blood bank, you are going to have a 30-minute window to administer that blood. So if I am the tech that works in the blood bank, I'm going to hand you, the nurse, the unit of blood. You have a 30-minute window to start transfusing that blood. If you have that unit of blood and if you know you're going to run out of time and it's going to go over 30 minutes, you might as well bring it back to the blood bank so that they can refrigerate it so that it doesn't get thrown out. We don't want to throw out good blood, basically, right? So once you get that unit of blood down to a unit, you're going to need 2 RNs to verify, okay? So we're going to verify the patient's name and date of birth, the blood type, the unit number, the expiration dates. So it's very important that you use 2 RNs, and that is pretty much every hospital policy in the United States of America requires that 2 registered nurses verify. So if I am the nurse and this is my patient, this is Mr. Lopez, I will tell you, the other RN, this is Mr. Lopez, and we verify that this is the patient. Mr. Lopez, he's O negative. We check that he's O negative. Expiration date on the bag is, and everything has to match. And we have to make sure that there is a prescription from a healthcare provider. Okay, it requires a signature. Okay, requires a signature from a healthcare provider. Okay, and just remember these right here. I know we went over everything on the slides. I'm just gonna remind you guys, so you guys, it stays fresh in your mind. I want to burn this material into your mind so you guys always remember, and that way it's just basically second nature, and when you see the questions come up, you know exactly what to say, how to answer. So prior to the transfusion, get a typing screen. We need to know the blood type. We need a prescription from a healthcare provider, so we need a signature. We need to get a set of vitals prior to starting, so we need a baseline to go by. We want to ask about any religious preferences in case the person or is unable to talk. Ask a family member if there is any religious preferences, so that we do not transfuse blood to someone that, for religious reasons, was never expecting us to do that for them. That's definitely going to be a lawsuit waiting to happen. And just remember, we need 2 registered nurses, not a registered nurse and an LPN, not a registered nurse and a doctor, not a registered nurse and a nursing assistant or licensed assistant personnel. None of that. It has to be 2 RNs by policy, and that's pretty much every single hospital in the United States. Okay, so 2, and for the NCLEX. For the NCLEX, it requires 2 RNs regardless. So you have to know that the answer is going to be, you need 2 registered nurses to verify that unit of blood and verify that this is the right patient. Okay, so this is prior to. So let's move on to what we're going to be doing once we start transfusing. So let's look at what we're going to be doing for administering the blood. So in the first 15 minutes, we're going to stay with the patient and we're going to administer the blood. So administer, so the transfusion slowly. Because if there's going to be any type of reaction, such as wheezing, crackles, a fever, is going to happen in the first 15 minutes. So we have to stay at the bedside for the first 15 minutes, and we're going to monitor that patient for any signs of allergic reactions or any type of reaction. Okay? And then in the 15-minute mark, again, we get a set of vital signs. Okay? So we get that second set of vital signs happens while we're transfusing the blood. And we want to make sure that there's no changes from the baseline, okay? And the reason why we are administering it slowly is, let me just erase this for a second. We're going to administer the blood slowly. So let's say this is the blood tubing. This is IV tubing, okay? And we're going to, remember, we prime the line before administering with normal saline. So let's say this is the normal saline going into the patient, right? That's the patient down there. And then the purpose of having the fluid in there is we're gonna administer the blood slowly, right? And so the blood is pretty much diluted. It's pretty much diluted during this stage because we're going slowly. And when the 15-minute mark starts, then you're gonna start noticing that the blood is finally gonna kick in and it's gonna take over that entire IV tubing, because now we know there's no allergic reaction. We can increase the rate, and now it's safe. Now the blood is not diluted like it was in the beginning, and now we're administering blood, the blood product itself, okay? Because at that point, I mean, prior to the transfusion, we're gonna clamp the fluids anyway. The normal saline is gonna be clamped anyway, but with time, the blood takes over, and now you have basically an IV line that is going to be entirely filled up with blood. And that's now when it's fully concentrated blood, pretty much it's no longer diluted, and now the patient is no longer at risk for a reaction. And so now we're transfusing the blood as we expected it to be, because it is safe now. But remember, for the first 15 minutes, we stay with the patient, we monitor the patient, and then we get a second set of vital signs on that at the 15-minute mark. We get that second set of vital signs to make sure that there is no reaction. After that, then we can safely increase the rate of administration of the blood product after the 15-minute mark. So let's look at what we do post-transfusion. So post-transfusion, we're going to get a set of vital signs set of vital signs, right? And that's going to be the last set of vital signs because we want to make sure that everything is okay, that the patient's blood pressure did not change from baseline. So we get a total of 3 vital signs. We get 1 before the blood transfusion starts for baseline purposes, right? So we make sure the patient is stable also. The second set of vital signs is taken at the 15-minute mark once the blood already began transfusing. So at the 15-minute mark after the blood has been transfusing, we get our second set of vital signs. And then our third and last set of vital signs, we get it once the transfusion has been completed, okay? Once the transfusion is completed, we can finally open up the IV line for the normal saline so that it can flush out the rest of the blood that was inside that tubing. Like I showed you, the tubing was full of blood. Now we're gonna open up the IV line to flush out the remaining blood that was in that tubing so that we can fully administer the entire unit of blood as expected, as we were supposed to. Because if you were to unclamp it, remove the line, then you just left a lot of blood in that line that was supposed to be administered to the patient. You did not transfuse the entire unit, so therefore you should open up that normal saline and finish out whatever is remaining inside and just keep the vein open for a little bit just to make sure that the patient gets the entire unit of blood, okay? So let's say I'm going to show you now what we will do in case of a allergic reaction. So what are we going to do with an allergic reaction? So we're going to be monitoring for a fevers, any back pain, wheezing, rash, crackles, muscle aches, headache. So what are we going to do? We're going to immediately stop the blood transfusion, remove that tubing, prime a new tubing, a new IV line with normal saline, and we're going to flush that, pretty much bolus that patient, and we want to keep that vein open. We call it keep the vein open. We want to prevent that from clotting pretty much. Okay, and then obviously stay with the patient because now this patient is considered a critical patient and contact the healthcare provider. So you want to keep an eye on that. And remember, most reactions will occur in the first 15 minutes when the blood is being transfused, okay? Most reactions occur in first 15 minutes, okay? Most reactions occur in the first 15 minutes, and that's why you have to stay with that patient in that first 15 minutes so you can monitor that patient for any signs or reactions. If there is a reaction, immediately stop the transfusion, okay? And change the line, put a new prime line, contact the healthcare provider, contact the blood bank, and more than likely that line that had blood in it that caused the reaction is more than likely going to have to be sent up to the blood bank so that they can analyze and find out what happened, what the source of the problem was with that blood transfusion that went wrong for that patient. All right, so that's pretty much it, guys. I left you guys a slide talking, basically describing hemoglobin levels for males and females. So familiarize yourself with hemoglobin levels and hematocrit levels. Remember, if you want to find out the hematocrit level, just multiply the hemoglobin by 3. And that should give you a good, pretty much close to the range where you have to be in case the NCLEX asks you what is a hematocrit. In case this person's hemoglobin is 12, we'll multiply that by 3 and your answer will be very, very close and tight to whatever the hematocrit should be. All right, so like I said, any questions you guys have, if I missed something, if you have any questions, I'm always available. So you send me an email and I'll get right back to you as soon as I can.